Most people over 65 are told the same thing. Keep your mind active, do the crossword. It sounds sensible, it sounds safe. But here is what nobody tells you. Crosswords alone do not protect your ability to live in your own home and make your own decisions. In 2024, an international commission of researchers published a major review in the medical journal, The Lancet. They concluded that close to half of dementia cases worldwide are linked to risk factors that can actually be changed. They named 14 of them. Not one of those 14 is a puzzle book. Today, I am going to walk you through 5 of those factors, counted down from 5 to 1. And I am going to add the one insight a 12-minute appointment almost never has time to cover. The number 1 item on this list is something almost nobody talks about. Stay with me until the end, because that one can change how you approach the next 10 years. Let me tell you why you have probably never heard this in a doctor's office. The average appointment for an older adult runs about 12 to 15 minutes. In that time, your doctor has to review your medications, check your pressure, look at your labs, and answer whatever you came in for. Memory protection is not a 15-minute conversation. It is a 10-year project, so it gets replaced by the shortest sentence available, which is keep your mind active. That is not laziness. That is arithmetic. I am not here to sell you a supplement or scare you into a course. This channel exists to give you the science a 12-minute appointment never has time to cover. There is no pill in this video. There is nothing to buy at the end of it, because the real fear here is not death. It is the morning your children start finishing your sentences for you. It is the day somebody else decides where you live and when you sleep. So before we go further, tell me one thing in the comments, your age, and the town you are watching from. I read them and they shape what I cover next. There is one mechanism underneath every item on this list. Researchers call it cognitive reserve. It is the spare capacity your brain has built, and the number of alternate routes it can use when one route goes down. 2 people can carry the same amount of physical wear inside the brain, and only one of them shows any symptoms. Think of your brain as a city, and think of your thinking as traffic moving through it. A small town with one bridge over the river is one accident away from gridlock. A city with 12 bridges, wide roads, and a night crew that clears the debris keeps moving even when a bridge closes for repair. Aging closes bridges in every single person. Staying sharp at 80 is not about avoiding the closures. It is about how many bridges you built and whether the road crew still shows up. Please do not skip this section. It is the key to everything that follows. Every item on this countdown does one of 3 things. It builds a new bridge, it protects the roads you already have, or it keeps the night crew working. If this is already making sense to you, tap the like button so more seniors can find it. Number 5 is not sleep in general. It is the block of deep, slow-wave sleep in the first half of your night, and the fixed wake-up time that protects it. During deep sleep, the spaces between your brain cells widen and fluid washes through the tissue. Researchers at the University of Rochester describe this as a clearance system, and it runs mostly while you are asleep. It rinses metabolic waste out of the brain, including the sticky proteins that accumulate with age. This is the night crew for the city we just talked about. When your sleep comes in fragments, the crew clocks in late and leaves early. Large sleep studies have consistently linked 6 hours or less of sleep in midlife and later life to faster cognitive decline. And sleeping pills do not fix this stage because sedation and deep sleep are not the same thing. So here is the protocol. Pick one wake-up time and hold it 7 days a week, including Sunday. Your body anchors the whole cycle to the wake time, not the bedtime. Stop all caffeine 8 hours before bed, and remember that tea and chocolate count. Keep the bedroom near 65 degrees Fahrenheit or 18 Celsius because your core temperature has to fall for deep sleep to begin. And if you drink alcohol, finish it 4 hours before you lie down. A nightcap puts you to sleep faster and then flattens the deep stage for the rest of the night. Now, a safety point that matters at our age. Do not make the room pitch dark to chase deeper sleep if you get up at night. Put a low nightlight at floor level between the bed and the bathroom door. And if you wake up gasping or your partner says you stop breathing, stop guessing and ask your doctor for a sleep apnea test. Pair this with morning light. 10 to 15 minutes of outdoor light within an hour of waking sets the clock that decides when deep sleep arrives tonight. Light in the morning, darkness at night. That pairing is worth more than anything on the shelf in the sleep aisle. But here is the limit of sleep. The night crew can only clean the roads it can still reach. If the smallest blood vessels feeding those roads are being damaged 24 hours a day, no amount of clearing at night will keep up. That damage is number 4. Number 4 is your blood pressure, and specifically the top number, your systolic pressure. Not for your heart this time, but for the smallest blood vessels inside your brain. Your brain is fed by vessels thinner than a human hair. Pressure that runs high year after year stiffens and scars them. When one closes, a tiny patch of brain tissue quietly dies, and on a scan, a doctor calls this white matter change. Those are your side streets closing, one at a time. You never notice one street. You notice when finding a word gets slow and doing 2 things at once gets hard. A large American blood pressure trial found that older adults treated to a lower systolic target had fewer cases of mild cognitive impairment than those treated to the usual one. Your pressure in your 60s shows up as your memory in your 80s. Here is what to do. Buy an upper arm cuff, not a wrist cuff, and measure at home twice a day for 1 week. Sit quietly for 5 minutes first, feet flat on the floor, arms supported at heart level. Take 2 readings 1 minute apart and write down the average morning and evening. Bring that single page to your next appointment, because 1 reading in a clinic hallway tells your doctor almost nothing. Most guidelines now aim for a systolic number under 130 in most older adults. And cut sodium where it actually hides, which is bread, deli meat, canned soup, and restaurant food, not the shaker on your table. Here is the stop condition, and it is important. If you take blood pressure medication, do not change a single dose on your own. Talk to your doctor before changing anything. Lowering pressure too quickly in an older adult causes dizziness on standing, and dizziness on standing causes broken hips. If you feel lightheaded rising from a chair, sit straight back down and report it. Pair the cuff with potassium. Most older adults get far too little of it, and potassium works against sodium inside those vessel walls. A baked potato with the skin on, a cup of beans, or 1 banana a day moves that number more than people expect. But pressure control only protects roads you already have. It never builds a new one. For new construction, your brain needs a signal that comes from one place only, and that place is your legs. That is number 3. Number 3 is not exercise in general. It is a specific dose of brisk walking, plus 1 strength movement for your legs, at least 3 days a week. When large muscles work hard, they release signals into the bloodstream, and those signals reach the brain. The best studied one tells brain cells to grow, branch, and connect, and researchers call it a growth factor for neurons. It acts most strongly in the hippocampus, which is the filing room for new memories. Your legs are the construction company for that city we talked about. No signal from the legs means no new bridges get built. Randomized trials in older adults have shown that regular aerobic exercise increases blood flow to the hippocampus, and in several studies increases its measured size. Walking speed itself predicts cognitive decline years in advance, and rehabilitation clinics see that pattern every single day. Here is the dose. Aim for 150 minutes a week of walking at a pace where you can talk but could not sing. That is 30 minutes on 5 days, or 22 minutes every day. The mistake almost everybody makes is strolling at a comfortable pace and calling it exercise, and comfortable does not send the signal. So add intervals. Every 5 minutes, walk faster for 60 seconds, then drop back to your normal pace. Here is the strength piece, done safely. Stand in front of a solid chair with your feet hip-width apart. Lower yourself until you just touch the seat, then stand back up. 10 repetitions, 3 sets, 3 days a week, and put a kitchen counter in front of you to hold if your balance is uncertain. Sharp pain means stop, not push through. Burning in the muscle is fine. Pain inside the joint is a stop sign. Pair the walk with protein. 25 to 30 grams within an hour or two of finishing gives the muscle something to build with. 3 eggs, a cup of Greek yogurt with nuts, or a piece of fish the size of your palm all land in that range. But building bridges is only half of the job. A bridge nobody drives across gets closed. What decides whether your brain actually uses the capacity you just built is number 2. Number 2 is effortful new learning, done in the company of other people. Not crossword puzzles, not brain training apps, and not television. A puzzle you are already good at runs on roads you already have. It makes you faster at that one task and nothing else. Difficulty is the entire point, because the feeling of being slightly bad at something is the sound of new wiring going in. And a live conversation is the most demanding thinking most of us ever do. You are tracking a face, a tone, a memory, and your own reply, all at the same time. The same Lancet review that named those 14 risk factors includes social isolation as one of them. Isolation is not only sad, it measurably shrinks the range of tasks your brain is asked to perform each day. Here's the protocol. Choose one skill you are genuinely bad at and practice it 20 minutes a day, 5 days a week for 12 weeks. A language, an instrument, dancing, drawing, or a card game with real scoring all qualify. It has to have a scoreboard, meaning you can tell whether you are improving, and it has to get harder as you go. Then add the social layer on top. 2 real conversations a week where you are learning something from another person, and at least one of them face-to-face if you possibly can. The safety modification here is about frustration rather than falling. If 20 minutes leaves you angry instead of tired, cut it to 10 and protect the frequency. Frequency beats duration every time in learning. And if your new activity involves standing, uneven ground, or dancing, spend the first 4 weeks with a hand on a wall, a rail, or a partner. Pair novelty with your walk. Learn on the days you train within a few hours of finishing, because the growth signal from your legs is still elevated. Move first, then learn. That order matters more than the total number of minutes. But every word of this depends on one thing arriving inside your brain in the first place. If the signal is degraded before it gets in, the best-built city in the world is running on bad information. That is number 1. And it is the item almost nobody talks about. Number 1 is untreated hearing loss, not deafness, the ordinary, slow, 20-year kind that everybody around you has already noticed and nobody has named out loud. Here is why this one is the crown of the list. When your ear delivers a clean signal, your brain spends almost nothing to understand a sentence. When the signal is degraded, your brain has to guess. It runs every fuzzy word against everything it knows instantly, over and over, and that guessing burns the exact attention and working memory you need in order to remember what was said. Picture a city where every delivery truck arrives with the address half rubbed out. Nothing is broken. But every driver is now spending an hour working out where the package goes, and the whole city runs slower. Then 2 more things happen, and they are worse. The parts of your brain that stop receiving rich sound get quietly reassigned, the way a road with no traffic on it stops getting repaired. And the noisy places, restaurants and church and family dinners are exactly where all your new wiring gets used. When those become exhausting, you stop going. This is not a fringe idea. The Lancet Commission I mentioned at the start ranks hearing loss among the largest changeable risk factors for dementia in midlife. And in 2023, a large randomized trial led by researchers at Johns Hopkins, published in The Lancet, tested hearing aids in older adults over 3 years. Among the participants who were already at higher risk of decline, the hearing intervention slowed the rate of cognitive change by roughly half compared with the control group. So here is the fullest protocol in this video, and it has 6 steps. Step 1, get a real hearing test called an audiogram, not a phone app, and not a guess. Ask for your numbers and ask which frequencies are down, because high frequency loss is what steals the S sound, the F sound, and the T sound out of every sentence. Step 2, if you land in the mild to moderate range, know that in the United States, you can now buy hearing aids over the counter without a prescription. Step 3, and this is where almost everybody fails, wear them at least 8 hours a day, every day. 2 hours on a Sunday does nothing at all. Your brain needs weeks of steady input to relearn how to hear, and for the first 10 days, everything sounds harsh and tinny for every single person. Step 4, give it 30 full days before you judge them and go back for one adjustment at the 2-week mark. Step 5, use speaker mode on the telephone and in a restaurant, sit with your back to the wall so the noise is behind you and the faces are in front of you. Step 6, protect what you still have, because one afternoon with a leaf blower or a power saw and no ear protection can take a piece of it permanently. Now the safety conditions, and please take these seriously. If your hearing dropped suddenly in one ear, that is not aging and that is an appointment this week. Ringing in one ear only, pain, drainage, or dizziness together with the hearing loss all need a medical exam before you buy anything. Never put a cotton swab, a hairpin, or oil into your ear canal to clear wax. If wax is the problem, let a nurse or a clinic flush it properly because that one visit alone can bring several decibels back. And if you already have hearing aids but they give you headaches or the sound is painfully loud, stop wearing them and get them adjusted rather than leaving them in a drawer for 2 years. Pair your hearing with the social protocol from number 2. The entire point of hearing better is to put yourself back into demanding rooms with real people in them. Book 1, noisy sociable event in the same week you start wearing them. Hearing plus conversation is the strongest combination anywhere on this list. So here is why I asked you to stay to the end. 4 items on this list build and protect the city. This one decides whether anything actually gets delivered to it. And it is the one that gets waved off for years as vanity or as everybody's hearing goes at my age, while it quietly removes the loudest and most social hours from your life. Sharpness is not luck. Memory is not genetics. Attention is protected. Consider a typical case documented in the rehabilitation literature. A 74-year-old woman living alone, doing everything she had been told to do, a crossword every morning, a walk with a friend most days, never smoked. Over about 2 years, her family noticed she repeated herself on the phone, that she had quietly stopped going to her book club, and that the television was loud enough to hear from the driveway. Her memory screening test at the clinic came back normal, and she was told this was ordinary aging. What changed was not a drug. She had a moderate high-frequency hearing loss, and she was fitted with hearing aids, and she wore them 8 to 10 hours a day, rather than for visitors. She set one wake-up time and held it every day of the week. She measured her blood pressure at home for a week and brought the page to her doctor, who adjusted the medication she was already taking. She added 60-second faster intervals to the walk she was already doing, and she went back to the book club. 4 months later, what her family described was not a test score. It was that she was interrupting again, arguing about the ending of a novel, and calling them instead of waiting to be called. Her walking speed had improved. Her evening pressure readings had come down, and she has not missed a book club since. So let us make this simple and doable. Here is exactly what to do, starting tonight. Tonight, step 1. Set one alarm for the same wake-up time 7 days a week, and let your bedtime fall where it falls. Move your last cup of coffee to 8 hours before bed, which for most people means nothing after 2 in the afternoon. Step 2, this week. Book an audiogram, a real hearing test, and if it has been more than 2 years since your last one, that phone call is the highest value 10 minutes in this entire video. Step 3, also this week. Buy an upper arm blood pressure cuff and take 2 readings a day for 7 days. Write the average on one page and put it in your doctor's hand at the next visit. Step 4, starting Monday. Add a 60-second faster interval every 5 minutes of your walk and do 10 chair stands, 3 sets, on 3 days of the week. Step 5, inside the next 14 days. Choose one skill you are genuinely bad at and put 20 minutes of it into your calendar, 5 days a week, for 12 weeks. Write it in the calendar, because a plan you never scheduled is a plan you will not keep. That is 5 steps. Not one of them requires a supplement. Think of someone in your life who turns the television up or who has quietly stopped coming to the noisy family dinners. Send this to them, or better, sit down and watch it with them. This is easier to hear from a stranger on a screen than from a son or a daughter, and you know that is true. Tell me in the comments which of these you are starting tonight. Your answers decide exactly what I cover next. And if you want the science a 12-minute appointment never has time to cover, subscribe to this channel. That is the whole mission here, the explanation instead of the sales pitch. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Judy Vance. Don't forget to subscribe and live longer.